Welcome to The Explainer. Today, we're going to take a pretty interesting journey through the body's hidden plumbing. We're going to follow the path from the kidneys all the way down to the bladder. And along the way, we'll see how a cancer's location can actually tell us a ton about its identity.
Yeah, have you ever really stopped to think about it? It's this super complex system we totally take for granted, right? But it turns out the geography of it, that's our very first clue to figuring out the diseases that can pop up there.
All right, so let's get into it. We're literally just going to follow the physical path urine takes. And as we do, you'll see how a cancer's specific address in the body gives us all these fascinating clues about what it is and how it behaves.
First stop on our tour, inside the kidneys. You can pretty much think of these as the body's super sophisticated filtering factories. This is ground zero, where the entire process kicks off.
So here's the thing. Different kinds of kidney cancer, they each have their own unique little calling cards. Now, clear cell, that's the most common one you'll hear about. But some of the rarer types, they have these incredibly specific links to a person's genetics or their medical history. It's fascinating. Let's check out a couple of examples.
Okay, medullary carcinoma. This is just a perfect example of that direct link between our genes and our cancer risk. If you've got the sickle cell trait, that's a huge clue for doctors trying to diagnose this specific and, yeah, pretty rare type of kidney cancer.
And here's another one, papillary carcinoma. It's way more common in people who've had a kidney transplant. You know, it really just goes to show you the long-term, complex stuff that can happen after a huge medical procedure like an organ transplant. It's something doctors have to keep an eye on for years and years.
And then there's translocation carcinoma, which is most common in kids. Now, what's really important to get here is, well, it's kind of a tough reality in medicine. Sometimes the very treatment that saves a life, like chemo for a childhood cancer, can actually become a risk factor for a different cancer down the road. It's why a patient's full medical history is just so crucial.
All right, let's keep moving. So from the kidney, the urine flows into what we call the upper urinary tract. This is basically the network of tubes, the ureters, that connect the kidneys to the bladder.
Now, in these super narrow tubes, cancer has a tendency to show up where urine might, well, where it might pool or slow down. The technical term is stasis. So why does that even matter? Well, think about it. If the flow slows down, any nasty stuff, any carcinogens in the urine have more time to just sit there and damage the cells lining the tubes. And that's exactly why the renal pelvis, which is that funnel right outside the kidney, is the #1 spot. The next most common, the very end of the ureter, right before it hits the bladder.
But we really need to put this into perspective. I mean, for every single case of cancer you find in these upper tracts tubes, you'll find about 100 cases of cancer in the bladder. The difference is just, it's staggering, really.
And this leads to a really critical rule of thumb for doctors. See, finding cancer in the bladder, that's pretty common, and it can totally happen on its own. But if you find a tumor higher up in the ureter, the chances are crazy high that you are also going to find it in the bladder. It's almost always a package deal.
All right, final stop on our anatomical tour. We've arrived at the bladder. This is the main holding tank, the reservoir of the whole urinary system. And it is by far the most common place for these cancers to show up.
When we talk about bladder cancer, the story is pretty much dominated by one main character, transitional cell carcinoma. You might also hear it called urothelial carcinoma. This one type, it makes up a whopping 90% of all cases. It's the big one.
Yep, this is your classic bladder cancer. It likes to grow at the base of the bladder, and it has this really well-known tendency to be multicentric. What's that mean? It means it often pops up in multiple spots all at the same time.
And what's cool is that even the rarer types have their own distinct personalities. Take squamous cell carcinoma, for instance. It's linked to chronic irritation, and you might even see these little telltale calcifications on a scan. Then you've got adenocarcinoma, which often shows up in a very specific midline spot. A big clue that it's tied to something that's been there since birth.
So, okay, we've made our way from the kidney, down the ureter, and landed in the bladder. What's the big picture? What's the main takeaway from all this?
The key thing to remember is that each of these cancers has its own unique fingerprint. By looking at the location, a patient's history, their genetics, even visual clues on a scan, doctors can piece together this whole puzzle and land on a really specific diagnosis.
And all of this leaves us with one final thought. This whole journey, right? It's been about reading signs and understanding patterns. And as we get better and better at decoding these biological clues, it pushes us that much closer to the ultimate goal, truly personalized medicine for every single patient.